Welcome to the three-part video series on partnering to improve diabetes management, presented by Superior Health Quality Alliance. This recording was developed for healthcare workers who have an interest in providing care to individuals with diabetes. This first video will address strategies to improve diabetes management, with the focus on identifying barriers and strategies to overcome them. You may watch each video in order or based upon your interest. The objective for this learning session is to achieve the following: identify barriers that prevent patients from effectively managing diabetes and discuss strategies to overcome them. Our goal is that after the video, you will have a better understanding of this topic and how it applies to your own healthcare setting. Let's start the session by reviewing the definition of diabetes self-management. It is the process of facilitating the knowledge, skill, and ability necessary for diabetes self-care. The key here is that it is a process to identify how you can best help the patient manage their disease. It's not a one and done. Barriers to diabetes self-management. So let's discuss the barriers we often hear about in the clinic and from patients in general. One major barrier is diet and understanding a meal plan. It needs to be tailored to what the patient is capable of doing. For some patients, a meal plan might mean snacking 10 times a day, while others might prefer 3 full meals a day. It all looks different, based on individual preferences. So, how often they eat and how many carbs will impact their medication regimen. And there's also a lack of information or understanding of that information. Managing their disease is not easy. It's more than just taking a daily medication. Creating a patient-centered medical plan is essential, and continuity of care is huge. When there's uncoordinated care between the hospital, clinic, specialists, it really causes problems in the patient's care outcomes. Patients are often taken off, so let's say they go in the hospital, right? And they're taken off of these medications, put on new medications, maybe they're using a sliding scale insulin now, and then they're given a new regimen of medications and insulin and then discharged. But if that information never makes it to their primary care provider, it can cause major problems in their glucose balance and also cause some confusion for the patient. And there's a financial burden. The cost of insulin, medications, foot care, eye care, routine clinic visits, blood work, managing one's blood glucose levels, medication regimen, and possible insulin injections can be tough. So we need to explore other treatment options that might make it more manageable for the patient. Physical inactivity is another barrier. We need to assess physical issues. Trust and relationships are so important. Ask detailed questions, and if a patient says they walk a little, find out what exactly that means. And medication adherence can be tricky, especially if there are cognition issues. When patients take their medicine but forget to eat, they can become hypoglycemic. If they eat too much, they can become hyperglycemic. And as noted, medication management can also cause financial burdens, and we need to be aware of resources that can assist them. Depression is also a significant issue. If a patient is too depressed to build a relationship with you, it creates a barrier, and our job is to listen, ask questions, and offer support. And limited family support is common, especially with patients living alone. So isolation, depression, and chronic disease make management of diabetes very hard. Self-management of diabetes strategies. Strategies to overcome barriers of self-management include consulting a nutritionist or dietitian. Certified diabetic educators are very helpful and accessible especially in hospitals and some primary care clinics. Continuity of care and building trust are crucial for creating an accessible, patient-centered model of care, especially in hospitals and primary care clinics. Self-monitoring of glucose and patient education are also vital. Patients need to understand why blood glucose management is important. High blood glucose damages the vascular system and every organ in the body. A patient's blood sugar log is a valuable tool, and it provides data and trends. If you see high and low levels, then you can address those with the patient. Ask what happened, what they ate, or if they exercised. This helps prevent hypo and hyperglycemia, as well as end-stage kidney disease. When discussing physical activity, we previously noted that it's important to ask detailed questions. So if a patient says they don't get out much to walk, maybe suggest going to a store like Walmart or going to the mall. And they don't need to start out with a half hour or an hour walk, even if it's just 5 minutes, just taking that first step. Adherence to medication routines is also extremely important. Explain the reasons behind their medication regimen and make it more understandable and encourage compliance. If you have to get innovative and creative, then do so. Do what works for that patient. And again, we're back to, also this is a financial burden. So share information on the different assistance programs, such as discount medications and free glucometers. We also need to explore other treatment options to make it more manageable. As previously noted, depression is a significant issue. So when asking questions, be very compassionate and empathetic. We need to identify and understand their barriers. We need to really know where they are to find how best to support them, to prevent those complications down the road. The assessment guide to patient-centered care is another good tool to use to overcome some of those barriers in self-management. Talk with your patient about how diabetes is affecting their daily life and their family support system, and what successes have they had managing their diabetes. Ask them what is the hardest thing they're experiencing with managing the disease, and what are they most concerned about or worried about. And finally, be sure to ask, how can I best help you? Patient-centered care is about patient education. It includes health literacy and incorporation of strategies appropriate for that patient's current situation. Create a plan together and manage the expectations of the patient. Explain to them the effects of diabetes on their entire body. We have created a list of tools and resources that you may find helpful. We encourage you to explore this information further. If you have any questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.